Hi, this is Eddie Garcia, Senior Vice President at Healthsperien, and this is For the Health of It. For the Health of It is a weekly podcast covering all things health policy, brought to you by Healthsperien, a nationally recognized health policy consulting firm focused on federal and state regulatory and legislative analysis, advocacy, and implementation issues. Welcome to our inaugural episode, where the Healthsperien team, along with several expert guests, will be diving into the COVID-19 pandemic. Up first, our weekly Healthspiration.
I'm Andrew McPherson, Managing Partner at Healthsperien, and this is your weekly Healthspiration. A pandemic of this magnitude is a public health crisis of global proportion that challenges our most treasured experiences and moments as humans, socially, celebratory, productive, and otherwise. What once brought us joy now brings us fear. Yet in challenge also lies opportunity. We as a global community, as a country, as states, as cities, and as towns across the United States can stop this virus in its tracks. But we must act both collectively and individually to perform the most basic yet necessary community-based mitigation measures to influence the course of the pandemic. Yes, this will take social distancing. Yes, this will take a demonstrated commitment to personal hygiene, but it will also take a commitment to advocate for our own health and for the health of our communities. We, along with Congress, along with the executive branch, and along with stakeholders across the spectrum, must do our part to protect the opportunity to live fully again. We at Healthsperien are committed to this promise, and that's what leads us to our discussion today.
Now join Healthsperien policy experts and friends for Stay in the Know, a weekly segment of the top health policy activities of the past week.
So for this segment, we are being joined by Dr. Cameron Muir, who is the Chief Innovation Officer at Capital Caring Health, which is a home-based primary care, palliative care, and a hospice organization serving the DMV area. And he is also the Chief Innovation Officer at the National Partnership for Hospice Innovation. So welcome, Dr. Muir. Thank you for joining us today.
Thank you. It's good to be here.
So with your background at both Capital Caring Health and NPHI, generally the patients that you and your team are focusing on and caring for are the vulnerable, chronically ill population that is currently understood to be most vulnerable to COVID. One of the challenges that comes up with caring for these patients, especially in their home and community settings, is ensuring that they continue receiving medical and other healthcare services, but without exposing them or increasing them to the risk of getting COVID. So in that sense, telehealth seems to be a really promising and critical tool for providing those services. I wanted to get your input a little bit on how you are currently using telehealth and what you see the opportunity there for telehealth services.
Sure. So the first point I think would be to say that all NPHI member programs are community-based, nonprofit, quality-oriented programs who are focused on the I word, innovation. And folks that are doing high-quality home-based care are actually in many ways in the best position to be able to take great care of folks in a particularly effective setting to mitigate or minimize the spread of COVID-19. And so home-based care is really probably the safest place to be. And if we can effectively reach folks in the home, which begins to get to your second point, to minimize bringing virus into the home and or contracting virus from healthcare workers going to the home, probably the single most effective moving from crisis to catalyst opportunity for us in this current time is, as you mentioned, is to really leverage telehealth. And I've been passionate about telehealth as a critical solution for anybody doing high quality home-based care for a number of different reasons, none the least of which is it's incredibly inefficient to spend a quarter to a third of one's career holding a steering wheel rather than actually being at the bedside providing care. And so these are some of the inefficiencies and the challenge prior to COVID-19, for which there are two primary barriers, I would say, to the adoption of telehealth. One is providers who feel very strongly often that the only way to provide care is in person. And I think that that is evolving. And we've seen agencies around the country, and one big healthcare entity, which actually crossed the 50% mark just a year or two ago in terms of virtual visits relative to in-person visits. So this is a huge opportunity to be able to leverage the effectiveness and availability and access, quite honestly. If I don't have to drive to someone's home, I can actually make 2, 3, 4, 5, 6, 7 visits for 5 or 10 or 15 minutes to do a follow-up visit multiple days in a row if we're using telehealth technology. And then secondly, it's a critical opportunity to work from an advocacy and policy perspective with payers to actually have them allow for this critically important work to be potentially reimbursed. So this is really a tremendous opportunity to deliver frequent, high quality care when appropriate to patients and families, and protect the professionals and their families, and to protect the patients and their families by minimizing the spread of any, quite honestly, communicable disease, but in this case, COVID-19.
Another interesting angle that we've been looking at and that's starting to receive a lot of attention in the healthcare community is how telehealth can also be used in addressing social isolation and mental behavioral health issues. So is that something that you are seeing as well and that you're looking to start integrating in this space?
Thank you. I think that's such a great secondary example of crisis becoming catalyst. And that is, we've been complaining about our kids and others resorting to their phones and being on social media and whatnot, and actually seeing the anxiety and depression rates escalate in the United States. I think we actually have an opportunity with thoughtful work to not only have the clinical medical solutions be driven by telehealth, but actually to look at, we've been involved in the DC area and the coalition to end social isolation. I think I'm suggesting we pivot with a completely new phrase, which is leveraging telehealth and technology platforms to be able to socially integrate to improve behavioral and mental health. So this social integration to improve behavioral and mental health is evidenced by websites and providers, for example, who have regularly for years actually recorded free mindfulness meditations and are available online. Yoga studios are teaching classes virtually and posting those up online. There are a ton of resources that if people are just slightly more creative and proactive, when we're seeing this happen rapidly in response to the social distancing associated with COVID-19 recommendations, that I think are really a huge opportunity to connect people in ways that they haven't been before. I've used the somewhat graphic representation to Richard Simmons, which a lot of folks of a certain generation might remember, the gentleman in blue sequin shorts who got folks off their sofas and energized and exercising in their living rooms remotely. This is an opportunity for 21st century behavioral and mental health, and potentially even physical health, by really proactively utilizing these for non-clinical medical, but for social integration and behavioral and mental health.
I don't think I've heard anyone reference Richard Simmons with respect to COVID-19 yet, so I think that was a very unique contribution.
It certainly provides a graphic visual for the people that I've talked to about this.
Most certainly. I had a quick question, though. Are there limitations to telehealth? I would assume that there are certain services that need to be done in person for some of the patients that organizations like Capital Caring work with. So do you have any comments on what are some of the other barriers or some of the other ways that in-home healthcare workers are affected by COVID-19?
Yeah, so that's actually...
Just to add on,
yeah, please.
And I was just going to say, just to add on to that, do you feel that the technology is currently there to support everything that needs to be done, or are there other things and other innovations that you're looking at and adapting?
Yeah, great questions. At the end of the day, what I'm going to say is my two things. One, my sort of primary question mark when I get up each day and really kind of think of the big questions in medicine and healthcare and advanced illness care, I put them along two axes that you're begging at by this question about telehealth and its limitations. There's absolutely no doubt in my mind that 100% direct care in the home, in person, might be considered to be the highest quality if you could also have it be efficient and with a frequency that would be ideal. And there's pretty good data on the other end of the spectrum. 100% virtual doesn't get you the highest quality outcomes that you want as often as you'd like. So my two primary research or questions, my hypotheses that I think we all need to challenge ourselves to try to address is there's a dose, and I'm borrowing from one of my colleagues in his language in New York, but there's an optimal dose that we don't yet know somewhere in the middle in a balance between two things. One is virtual versus direct care, so in-person visits versus video visits. There is a balance. We don't know what it is, and we don't know what that optimal balance is. And there's also a second question, which is the balance of disciplines or the mix of disciplines, the dose of nurse, the dose of social worker, the dose of chaplain, the dose of doctor, the dose of nurse practitioner, the dose of volunteer, et cetera. That is the optimal combination. And in this case, it probably might vary by diagnosis, by family dynamic, by socioeconomics. These are the critical questions from my perspective that I think if we could strive to understand, and the more that we strive to understand the answers to those, to me, we'll be getting to truly innovative 21st century, highest quality possible care. Finding that dose and balance between virtual and direct, and finding that optimal mix of resources depending on the patient and the family and the diagnosis and the circumstances. These are huge opportunities going forward.
Your colleagues are all out there and still on the field and making sure everyone's receiving care. So I just wanted to thank you for everything that you're doing 24/7 around the clock. So
well, thank you.
In addition to that, it's so important, everything that you're doing. We really appreciate it.
Well, thanks very much. It's a privilege to serve and happy to have the opportunity to share a couple of thoughts with folks today.
We are joined by Jenny Babcock. She's the Vice President for Medicaid Policy and Director of Strategic Operations at the Association for Community Affiliated Plans. Thank you for joining us, Jenny.
Thanks very much for having me.
So I think, there's a lot that health plans and Medicaid are thinking about, and one of them is a major issue as these incremental costs and issues with medical loss ratio. But I'd love to hear your thoughts on what are some of these key things that Medicaid is thinking about and key things that Medicaid managed care are thinking about with respect to COVID.
Thank you. Well, I wanted to start by appreciating what you just said about this concept of social isolation and how we have to be mindful as safety net health plans, as Medicaid health plans, like the whole person, the whole person that we are covering gets what they need. And there's a lot of conversation right now about how Medicaid and the health plans that are serving the Medicaid program can address that key factor of social isolation while people are maintaining their physical health by staying behind closed doors and avoiding social situations. And this is just an aside, but I actually myself was quarantined last week because of an unfortunate appearance at an event where someone ultimately tested positive. And I just observed my own behavior. I was still working. I was still Skyping and Zooming with people every day. But the idea that I wasn't able to get out of the house, check in on my sister and my mother, other people that were around me that are vulnerable health-wise was really anxiety-provoking. And so I'm sure that there will be a lot that we have to address with regard to that. But I think that at its most foundational level, what we have to think about with regard to the people that are served by the Medicaid program is, simply put, access to services, coverage for that services, and then affordability. And you can, of course, apply those foundational elements to everybody, regardless of where they get their coverage and care. It's important that everybody who needs it gets testing, and we've had some confusing guidance about what is and is not available. And I think that in many communities, many people still lack clarity around how they get tested, how they approach their health professionals to get those tests, and treatment will become increasingly an issue as well. So from the Medicaid health plan perspective, we are mindful that the plans need to be ensuring that the people that they cover, their members, have their coverage, right? First of all, that they don't spin off or churn off their Medicaid plan or their Medicaid program. Second of all, we need to make sure that the providers are in place and are increasing their capacity to address the burgeoning needs of the people in their communities. And so I know that our health plan members are in close communication with their states. Their states, of course, have been waiting for the administration to declare a national emergency, which did happen late last week, so that states could begin accessing flexibility by way of emergency 1135 waivers and emergency 1115 waivers. What we would like to see with regard to those waivers is loosening up of eligibility rules so that this phenomenon of eligibility churn, people churning on and off the rolls, regardless of their actual eligibility because of lost paperwork and that sort of thing, just stops happening, right? We can't have people who need coverage and care not have ways to get it, or we can't have them presenting to providers who are already strapped in terms of their resources, not getting the payment that they need from the Medicaid program to provide those services to these individuals. And it goes without saying, perhaps, I'll say it, that the states need to be resourced for this as well. We are keeping a very close eye on the House package that was developed late last week. That includes, I believe, a 6.2% bump in the federal match to states. This will help states resource themselves so that they can pay providers appropriately for the care that they will inevitably be providing.
Right.
We need the Senate to step in and, take action on that package as well. And we are very hopeful that it won't devolve into, Medicaid has been really politicized over the past number of years. And we have to, I think, press our elected officials not to further politicize the program in this case where people really, really need emergency access to care.
Would you be able to speak a little bit more about what this House package could mean for safety net plans, and what are some of the different scenarios for with or without? Well, let's say that the House package goes through. What does that mean for safety net plans moving forward, and the different scenarios for how the COVID virus could go in terms of how many people are infected and how many people are impacted?
Oh, thank you. That is a good question. And we are watching to see where it goes, how it makes its way through the Senate, et cetera. But on the one hand, the bill would provide, we hope, some relief to our health plan members as employers. And that's something we don't necessarily represent them on the Hill as employers, but every single organization that employs every single one of us these days is undoubtedly worried about how to manage the myriad issues that come along with people having to stay at home and work and potentially getting sick. So that's one key part. The other part is just specifically related to this 6.2% federal Medicaid medical assistance percentage bump. And when we talk to our plans about what they, so far we've had like 5 conversations with them over the past 2 or 3 weeks, asking them what they really need. Health plans that serve the healthcare system and Medicaid, we have to be mindful that not only are our plans providing a beneficial service or a slate of beneficial services to people, meaning ensuring access to care and ensuring that the providers are paid appropriately for that care. Those are very key pieces, right? Our plans also provide lots and lots of additional services to people, making sure that they have food assistance, helping them seek housing, and ensuring that those risks of social isolation are appropriately addressed before they become a real problem. The plans, like the providers, and I run the risk of sounding very mercenary here, but the plans like the providers and like the states and the layer above them need to be sure that they are appropriately resourced to continue to provide these key services. And so when I asked my plans about what they need from ACAP in terms of our representation of them in Washington, they were thrilled with the idea that their states will get the bump, the financial bump from the feds that they need. It was the top level issue. If their states are appropriately treated by this bill, then the plans and the providers are far more likely to be also appropriately resourced so that they can then manage this crisis. We actually are also going to go back to Congress. We will see further packages, coming out of Congress to address this. We've seen the one $8.3 billion package that was already signed into law, and the second one is on the move right now. We, though, in anticipation of additional consideration by Congress of what the nation needs to address this health crisis, we're going to go back and ask very specifically for Congress to ask states to provide continuous eligibility to the Medicaid and CHIP regulations so that we know for certain that everybody who is eligible for these programs gets their coverage and gets their access to care for a full 12 months until we can be certain that, for the most part, the crisis has died down. We are also going to ask, I think, for Congress to I'm not sure how to say this properly. I'm probably not wording it properly, but we would also like to see Congress weigh in on asking CMS not to waive what are called actuarial soundness standards. So CMS has to ensure that states are properly paying Medicaid health plans for the work that they're doing and the rates that they're paying providers. It's simply a requirement that there's adequate resource to be passed from the states to the plans to the providers. And so we want to be sure that the states don't make use of flexibility with regard to emergency waivers to do that. That sounded very mercenary. I'm not sure that's a good thing for a podcast, but it actually is a very important issue. Like the public should be very mindful that the providers, the hospitals and the physicians' offices and the FQHCs that are treating the people who are impacted by COVID-19, we have to be very mindful that those providers are given the tools that they need, and that includes the financial tools. And so if those providers are part of a managed care system under the Medicaid program in their state, and most are in most states, we have to be sure that the system is resourced properly at every step of the way.
Great.
That's what I'm
Thank you very much for joining us, Jenny. And we look forward to seeing more of how we all react to the unfolding situation. But we appreciate you taking the time. And yeah, I don't know how to end these things because they'll edit out.
Me neither. But thank you so much for having me, Michael and Priya. It was really nice to talk to you. And let me know what else I can do. Okay.
All right. Well, today we are joined by Tom Bednar, another fellow Vice President here at Healthsperien. Tom, thank you for joining us today from your Philly office.
I'm happy to be here. Thanks for having me, Priya.
So one of the things that we've been talking about on today's podcast, and Michael and I were speaking to a little bit earlier, is the federal response and guidance that has been occurring in response to the COVID, and a key focus being on what are the resources and support and flexibility available, financial and otherwise. So as of Friday, President Trump declared a national emergency. So this was a very important declaration in the timeline of what's happening currently, right? So Secretary Azar declared an emergency a couple weeks ago, and a lot of states have been declaring emergencies, and there was a wait for the president and the administration to declare a national emergency under the Stafford Act so that it could trigger some release and flexibility of funds and other waivers. Is that correct?
Yeah, that's right. So I think Friday really reflected the kind of regulatory inflection point that we've been waiting for in terms of next steps, in terms of the federal regulatory response to the COVID outbreak. As a bit of background, you mentioned this, but the main primary authority that HHS and CMS have to implement waivers of regulatory restrictions and to waive other limitations related to the Medicare, Medicaid, and CHIP programs is through Section 1135 Waiver Authority. And that authority in turn requires the secretary, both the secretary and the president, to declare national emergencies. And as you mentioned, Secretary Azar did so on the 31st of January. And this past Friday is when President Trump finally declared a national emergency under the Stafford Act. So this remains, go ahead.
Yeah, so I was going to say the Section 1135 waivers have now kind of been triggered, correct? And then another piece of this is in the first COVID package that was passed, there were some key telehealth provisions that were also tied to this declaration. So could you highlight a little bit on what this means for both of those?
Sure, absolutely. As you said, there's a strong relationship between Section 1135 authority and what's happening in Congress. The first package, as you mentioned, specifically included expanded telehealth flexibilities within it that were tied specifically to the language of Section 1135. But of course, those couldn't be activated until 1135 was triggered through these declarations of national emergency. And so that's what happened on Friday. And we've subsequently received guidance from CMS related to a broad range of issues. But we're still waiting on even more guidance related to telehealth provisions. And furthermore, we can expect further overlap in subsequent congressional-led pieces of legislation, overlap between their efforts and Section 1135 authority. So this relationship will continue to develop as with all of any sort of activities and responses related to COVID. It's a very dynamic time right now.
Since the declaration, could you talk a little bit about what's been issued and then What additional guidance do you think we'll see perhaps in the next week or so coming out from CMS in addition to the telehealth flexibilities?
Of course. So there's existing structures outside of Section 1135 authority that has allowed CMS to issue various FAQs and guidances related to emergency responses in general in Medicare and Medicaid. Medicaid has a disaster preparedness kit that allows CMS to issue guidance related to flexibilities around prior authorization waivers. There's been guidances on not just telehealth restrictions, but most notably payment for treatment under Medicare and Medicaid for COVID testing, as well as discussions around treatment. But really, up until Friday, CMS could only operate within the existing authority. Once 1135 was passed, we can now expect more guidance, and we can, moreover, on the Medicaid side of things, expect states to affirmatively ask for specific waivers of a broad range of authority. Like I said, prior authorization, testing, telehealth services, all of these things are now available for states to affirmatively ask a waiver of for the federal government. That, of course, is a key difference between the Medicare and Medicaid programs, is that any large-scale changes on the Medicaid side of things has to come from a state request, whereas on the Medicare side of things, the federal government has much broader authority to make national changes affirmatively for everyone.
So to clarify, unless the states ask for it, there wouldn't be flexibility just automatically offered at the state level in terms of Medicaid programs. Is that correct?
That's right. Yep. Implementation of these waivers and authorities is incumbent upon the states in Medicaid in a way that it isn't on the Medicare side of things.
Okay. So on the Medicare side of things, whatever happens, they'll release some guidance, some flexibility, some waivers. For example, in relation to the telehealth services that we're talking about, omitting site of origin requirements and other flexibilities. But at the state level, what do you expect states requesting at the state level for some flexibilities here?
Well, I can expect changes to prior authorization requirements, which is now available.
For prior authorization for anything specific or just generally?
Well, that is a hot topic. So I think the low-hanging fruit would, of course, be prior authorization requirements for any services or treatments related to COVID. But one thing that I'm keeping an eye on is the possibility that states become interested in broader waivers of authorization for ancillary or adjacent services that may be impacted by the outbreak. So, for example, you can imagine a request to waive prior authorization requirements for behavioral health services that are intended to mitigate the impacts of COVID. So social distancing and isolation are likely to have some sort of mental health impacts on a population level. And to the extent that prior authorization requirements limit access to such services, we could see states looking to kind of ease the restrictions on access to those kinds of things. That, of course, has repercussions. That is going to have a direct impact on state budgets, given the funding structure of the Medicaid program, and it's going to have a direct impact on federal budgets. So watching these types of dynamics play out is going to be interesting over the next few weeks. And it's important to remember that not just from an intellectual level, but these changes have significant impacts on people's lives. And so we have to always remember that it comes within the context of a broad pandemic that is not just costing us money, but significantly harming individuals' overall well-being.
Yeah, you raised a really good point there. I think a couple of really good points. Michael and I were talking about earlier how there are a lot of policies that have been advocated for within the healthcare space, behavioral health, social determinants of health, and others along these areas, social isolation, that are starting to really kick in at this time. So looking at those ancillary services and what happens with those under COVID pandemic, but also going forward, the lasting impact that they'll have and the effectiveness to really help provide additional support and services to those in need. The other thing I was just kind of thinking through is, you raised this point about the financial impact. What is happening in terms of, there's some relief being offered, but what's happening on the federal level in terms of the financial support that is being reviewed and could be passed down to the states as well as plans and also patients?
Sure. So sticking with the Medicaid side of things, we know that in the current bill being discussed in the Senate, there's a proposed 8% increase rate for eligible states. There are certain criteria they would have to meet for their FMAP percentage. FMAP, of course, being the underlying federal matching system that funds Medicaid. So essentially, eligible states could see an 8% bump or 8% increase in federal funding for them. And that would be a huge boom and would go a long way to mitigate the likely increased impact on state budgets. Of course, that bill has to pass. And moreover, on the Medicare side of things, again, much of this has to come from the legislature. We know that there have been calls for, and right now, House Leader Pelosi and Steve Mnuchin in the White House have come to some sort of agreement on an overall secondary stimulus package that is likely to include increased funding for Medicare. We're not sure exactly what the specifics of that are, but we do know that these kinds of questions are being discussed right now in Congress.
Okay, great. Thank you for your insight on that. I think with the declaration, is there anything else at this time? I know we're waiting for several guidance and the congressional packages, but at this time, is there anything else that we should be looking at in terms of statutory authority or other regulations that we should keep an eye on as we're moving forward?
I'd say certainly keep an eye on continued guidance from HHS and CMS, continued action on Congress, as you said. But I'd also say I'd recommend that people keep an eye on state responses as well, because outside of not just Medicaid, right, states have the primary authority to govern their Medicaid programs, but states also have the primary authority to govern many of their individual exchange plans and various other forms of insurance. So keep an eye on state requests to CMS for broader changes as well.
Great. And any last closing thoughts, key points, takeaways from, I guess, since this whole situation has started?
Yeah, I think hopefully that first and foremost that the federal and the state governments are able to continue to act and respond to the needs of the beneficiaries and the needs of the American public. But I think after the fact that this will serve as an important opportunity for reflection on ways that we can improve and better coordinate our response to these kinds of activities. And it will be incumbent upon various stakeholders to engage in those conversations. And that includes payers, providers, regulatory agencies, and even individual advocacy agencies. This country hasn't faced something like this in a very long time, and I think it will be incumbent upon us to reflect well on it if and when this passes.
Great. Well, thank you for your time today, Tom. Hopefully we'll be back in the office soon, and we'll...
Yes.
Tom, are you still in your pajamas today?
I am, as a matter of fact.
Might as well be comfy and isolated, right?
Yes, absolutely.
All right. So today we've had some really interesting discussions with all our experts and our team members. We've been hearing a lot of different interesting perspectives in terms of where we are today and where we would like to be in the next week and so, and what this means in terms of long-term effects. I think generally, Michael, what do you think? We've been hearing a couple of key themes throughout all our discussions today.
Yeah, I think the first one that really stands out to me was really highlighted by Tom Bednar, which was the unique federalist nature of the American healthcare system has been brought to the fore, and we're seeing how challenging, what the opportunities are, but also what are the challenges for Medicaid services, for example, and how the federal policy affects state policy, which affects Medicaid programs, which affects the real people on the ground. So I think the way that our healthcare system is structured, I think we have an opportunity to see its challenges. And I think it's going to be an interesting few weeks as Congress meets to come up with packages to deal with the coronavirus, how that plays out politically. It'll be very interesting to see.
Yeah, and I think a second theme that we're really hearing is this focus not only on treating, identifying, testing for COVID, and providing other medical services, but also thinking about all of the ancillary services that are just as important and critical in these times. So focusing on social determinants of health, social isolation. So as we are self-quarantining ourselves, what's the impact there on mental and behavioral health? And how can we ensure that we are addressing those needs as well? And there's an opportunity here to really leverage what we're hearing from everyone, some of the innovations that are already out there to start catalyzing those and using those as a means. So it's very interesting to see how in addition to the medical side of things, there's a full focus on the integration of the social aspects of healthcare that have been coming to the forefront in recent months with all of these discussions. So definitely an opportunity there, and it seems very interesting to see how all of that gets played into what you're talking about, what you were just mentioning, Michael, in terms of the political packages that are accepted, but just the response from the medical care teams and from the health plan providers in terms of addressing those needs as well.
Yeah, there's definitely been a momentum, so to speak, of social determinants of health becoming more important. And it's interesting to see how that's integrating into a very healthcare situation. I think social determinants of health and of mental health, right? So there's, of course, the two. Yeah. I know that I'm getting a little stir crazy as it is here. And I know that people who live more isolated, it'll be a challenge. It's a very real thing. And I make light of it, but it can be an important piece of this response. I think the final theme that I would pull out is uncertainty. A number of our experts talked about uncertainty related to the disease, uncertainty related to how the different systems that we have in place will react to the disease, as well as the bureaucracy around addressing some of the core public health and healthcare measures that need to be taken, and how things are going to change over the next few weeks. I think as of today, we're going to have an announcement from the CDC and the White House, and we'll see what new news there is. And every day there's more news, so the situation continues to evolve. And I think so far the news has really focused on school closings and stimulus packages and the various elements of our public health response that have some good, some bad. But we know that the politics are rapidly evolving. I think we've even seen typical conservatives on the Hill advocating for direct stimulus packages, and as a result of just sudden shock in demand or sudden low demand. So it's interesting to see this evolve as we face the crisis. And so I think to wrap up our discussion today, we're going to turn it to Andrew McPherson, who's a managing partner of Healthsperien, to get his take on the political implications of COVID and what policymakers are doing to address this public health crisis. And we hope that you can bring in a big picture perspective on what's going on right now in DC, on the Hill, and even in the States.
Yeah, and thank you, Andrew, for joining us today. I think really just looking at building on the last theme that Michael just mentioned, with all the uncertainty, how quickly things are rapidly changing from a day-to-day basis, but the uncertainty also in the longer term with what this may mean for healthcare down the road as a longer-term solution to certain things. So very interested in your take on what's happening in terms of the political play on the Hill at the federal and state level.
Well, thank you, Priya, and thank you, Michael. Look, I think the bottom line is this is an extraordinarily complex and just fast-moving process for the government to determine, hopefully on a bipartisan basis, how to support those tens of millions of Americans that will be and already are impacted by the pandemic. The House did pass legislation this past weekend that was overwhelmingly bipartisan. It does a whole variety of things. The president actually supported the bill. It's the Families First Coronavirus Response Act, H.R. 6201. It funds the testing for the uninsured and veterans and Medicaid recipients. Also, patients of the military and Native American health systems. It also requires private health insurers to provide free testing for coronavirus, including the cost of an emergency room visit or clinic visit to get tested. It requires employers with less than 500 employees to provide 2 weeks of paid sick leave for people who become infected with coronavirus or have to care for someone who is, as well as people who are quarantined. It does provide $1 billion in grant funding to states to expand unemployment benefits for people who lose their jobs. It also, I think importantly, gives government employees and employees of companies with fewer than 500 employees the right to take up to 3 months of leave from their jobs. So it's a pretty comprehensive approach. It is getting some pushback in the Senate. The House has actually left town for the foreseeable future, so the legislation is very much in flux. We've already seen several Republican senators say that they don't believe that the House bill does enough to protect small businesses or does enough to provide an influx of cash directly to Americans who are struggling to cover the short-term costs as coronavirus concerns just begin to just have this really severe impact on the economy. And I think the economic question is really the key here because, number one, I think that we're going to see we already are seeing widespread layoffs as a byproduct of the public health crisis. So the political case, no doubt, will likely grow for greater federal financing under the Obama health law, or even as Medicare for All and single payer proposals backed by the likes of Senator Bernie Sanders and others gain more attention. So I think there will be a political dynamic there, thinking about while the 2010 Obama health law is in flux with the Supreme Court, and the Supreme Court is considering the lawsuit that's backed by the Justice Department to eliminate it, individuals who are laid off and others are going to really be relying on the subsidies and the federal financing under Obamacare to support them throughout the crisis. So I think that's one of the dynamics that we really need to keep an eye on going forward. Interestingly, so far, the president's approval rating really has not changed. It's still hovering around 46, just under 50%, around 46 or 47%, depending on what poll you're looking at, which is largely unchanged from previous polling. Republicans largely support the president in his response to the pandemic. Democrats, 84% disapprove of the president's handling, and the independents are hovering around 43% favorable and 52% disapprove. So we haven't really seen a major change, frankly, in the polling as it relates to the president. We are going to see more legislation passed. Even though the House is gone, I would predict that they would come back, certainly if they need to come back to pass the current legislation, if there's changes made by the Senate or in the negotiations with the White House, I think they would come back to make sure this is passed. But I think we're likely to see more legislation down the road. There was a quote just today from Treasury Secretary Steven Mnuchin saying that we're going to get this bill done and more bills done on a bipartisan basis going forward. I think we'll see something to address the airlines, to address the hotel industry, and to think about ways that we can support a whole range of industries as we get deeper into the crisis. So things seem to be changing by the day, changing by the minute, changing by the hour, and Healthsperien is keeping a close eye on all these dynamics moving forward.
And here's our industry trend foresight.
This is Jean Dessau, Senior Partner at Healthsperien and President of Healthsperien X, the firm's innovation hub. As we look at the unfolding situation with COVID, we are asking our team every day how we can help our clients as they adapt under high pressure and rapidly shifting conditions with substantial implications for members and patients, especially the most vulnerable. As they respond, what do they need from government? Do they need funding or relief from regulations? Can we support them in developing effective policy change for the future? We start from the premise that this is not the country's first rodeo with a public health emergency. Over the last 2 decades, government, the private sector, public health experts, and the scientific community have put into place initiatives and resources to enhance preparedness for pandemics more generally. While weaknesses have emerged in this system, there are also important elements in place to allow us to successfully navigate this crisis. As we noted earlier, important lessons exist from previous pandemics and health situations and natural disasters. Avian flu, anthrax, swine flu, SARS, Hurricanes Katrina and Harvey all come to mind as important events to review. We have a dynamic healthcare sector with enormous responsibilities for patients and population health, and with capabilities at innovating, including in a crisis and uncertain and changing conditions. Important, too, is keeping an eye on the unique aspects of this crisis and what has changed since the last one. Scientific advances in genomics, epidemiology, and drug development have been game changers. One of the areas we will focus on in this series is the evolving scientific landscape and its role in slowing the spread of the coronavirus. We are paying particular attention to the development of antivirals and other countermeasures and incentives for their effective integration into the public health response. On the other side of this, we intend to be there for our clients and the broader public as they operate in what will be a changed and energized healthcare system, facing the future with lessons learned from this experience and an openness to the continued role of innovation. Thank you.
Well, that's a wrap for this week. Thanks for tuning in. If you have any questions on anything you heard on this week's episode, please head over to healthsperien.com for more information and deeper analysis. And as always, tune in next week for more policy insights.